A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Hello, and welcome to Living Well in the Community, hosted by LIFTT, or Living Independently for Today and Tomorrow. LIFTT is a center for independent living where we serve people with disabilities and the aging to help them stay independent. We serve the 18 counties in southeast Montana. So my name is Eileen. I'm a nutritional health coach at LIFTT, and I'm here with our newest member of our team, Lynn. Lynn, I'll have you introduce yourself and give us kind of a background of how you got involved in health and wellness and why you're interested in helping people with diabetes.
Thanks, Eileen. My name is Lynn. I am a certified nutritional health coach. I am interested in diabetes because I have a nutritional client that is type 2 diabetic. I met you at LIFTT taking the type 2 diabetes class. And I am interested in running the program because I feel that diabetes is an epidemic in our country right now. And the more people that we have that are educated and can help people learn to handle diabetes or prevent diabetes is very, very important.
Yes, absolutely. And it's great that we're here today to talk about our programs. And
yes.
I know Lynn's quite new, so it'll be a fun conversation with the two of us. So yeah.
So there are a lot of programs at LIFTT, and I get to be involved in all of them. There's a new one coming up. It's called Decide, and I believe it's starting on October 10th.
Yes.
So tell me about it.
Sure. So we have been offering the diabetes prevention program, and now we're excited to be able to offer people a program that is specific for diabetes. So it's a 9-module class or a 9-week class. People can really, it identifies what they need to work on. So that first meeting is up to 2 hours long. So we go through the basics of what is diabetes, where your numbers are, and when they start seeing what can help them, that way they can start identifying what actually they personally need to work on. So if someone has diabetes, it gives them the chance to identify that, and then it's a problem-solving class. So from there, we slowly work through what it looks like to make goals and what are some of the barriers to those goals. So a lot of people have just been sent home and told you're diabetic or pre-diabetic, and they don't necessarily have the skills or the tools they need to handle that. So this gives them those problem-solving ability to whatever comes their way, which I love. Even though it's 9 weeks, you can use that same system over and over again. If something new comes to you and you're struggling, you'll have the materials. You can work through those same materials to continue to use what you've learned in the program.
Excellent. You also mentioned that they go to the doctor. They're told they're diabetic or pre-diabetic, and they go home. Sometimes they don't have a support system. So a class with other people that are in their same situation, they have the support. They have the peer support, conversations, work through problems together, and get ideas.
Exactly. Yep. Yeah. And really that's the beauty of a group setting, is people can get so many ideas from each other and even share frustrations. There's definitely similar things that they experience, so having that support group is very helpful. So, yes.
Excellent, excellent. I'm looking forward to the class on October 10th. If this class is for people that already have diabetes, what do you suggest for people who are pre-diabetic?
Right, so for the pre-diabetics, we have a year-long class. So the first 4 months we meet weekly, gives them the tools that they need for exercise, nutritional decisions. So those are weekly classes, and then we start to spread it out. Then it becomes every other week, and then pretty soon it's just once a month. So these people, again, are getting the tools they need to be able to move on their own. And again, that support is wonderful to have. So
that's where I met you, is at the pre-diabetes class.
Exactly.
Group support, Because when I started, I knew very little about pre-diabetes and diabetes. I've learned a lot about the class. The group support, the conversations that we've had have been just very informational for everybody.
Right.
And that is, I think, what I've liked the best. And you get the tools, you have great information that you can hand out, and I've looked at it. You have exercise sheets and things like that. Yeah, there are a lot of tools in the pre-diabetes class. Absolutely.
Right. Yes.
Absolutely.
And actually, as a coach, or if we're more facilitators,
yes,
I mean, we get the benefits of everyone else too. When people start talking about changes they can make, there's a lot of that comes back right to us, and if they're going to try that, maybe I'll try that too. So it's a fun exchange for everyone. So,
and the exercise, because you want them to exercise a little bit, and they're like, I feel so much better. That's much better. Speaking of exercise, you and I have been doing a lot of that today because we offer a lot of exercise classes at LIFTT. So we have done several of them today. Tell me about them.
All right. Well, starting with Tai Chi.
Yep.
Tuesday mornings at 9 o'clock. Anybody that just maybe needs to calm down. It's great for mobility. It's lots of deep breathing. The neat thing about it is it also puts us in the moment. A lot of times we're rush, and we forget to enjoy the moment. So, which also in the long run, when we're trying to make health changes or do things that are changing our habits, it makes us more mindful and able to maybe stop and breathe before we jump in and do something. So Tai Chi is very gentle exercise. It's a form of a martial arts, but it's done very slowly. It's always fun to hear the reactions that people have. They'll think, oh, that wasn't much. And then the next week I'll say, so what did you learn or what did you notice? And they'll say, it wasn't until a few hours afterwards that they could really tell that they had done something. So there are benefits.
I did hear that in class this morning. Yeah.
Yes.
Yep.
Yeah.
And then we did another class called SAIL.
Yes. Yep. So SAIL stands for Staying Independent and Active for Life. It's both Tai Chi and SAIL are meant for preventing falls. So it's really based on balance. We want to make sure that we're strong. So SAIL focuses more on strength training. We're using light weights on our arms. We're also using light weights on our legs, but also just getting that movement. And as we use those weights, we're able to control better so that we're not falling down. And another great thing about these classes is they can be done seated or standing. So it's really something that is accessible to anyone, depending. You do not have to be active, or if you're sedentary, this is a great place to start.
Yes. I loved the breathing exercises in the Tai Chi class this morning. I know I'm going to feel all of this tomorrow because this is all different things that I did today that I did not do in normal every day. And it's going to be a little sore tomorrow. Lower back issues, so my lower back is tight. I will feel that tomorrow, but I think it's going to be ongoing because I plan on attending every week, and I hope other people will come and attend. You were saying that they can be seated while they do that. We have a lady that is in a wheelchair, and she's in the Tai Chi class, and she did say that she has noticed that she is breathing better, that's just phenomenal.
Yeah. And
in the SAIL class, people were saying that they're up and down stairs easier.
Yeah.
They are doing classes or exercises if they are in physical therapy, and they're finding their physical therapy exercises are a little bit easier because they're attending SAIL. So it works on all levels, all levels. So
yes, yeah, it's fun. I like to throw out there that do they notice any differences, or what changes are you seeing, and just I'm feeling stronger. I can keep up with people better. Things like that are very encouraging, and that again, it encourages everyone that, yeah, maybe I am noticing those same changes. And being able to stand on one foot and balance to maybe pull on your pants in the morning.
Yeah.
So, and becoming aware, part of this has an educational component to it. So we want to make people aware of any fall dangers. Today we talked about animals, that how easy is it to
Step
trip.
over your dog and trip.
Exactly. So just being aware of what can cause a fall, and just knowing that, oh, maybe I should slow down a little bit. If there's a dog coming at me or laying somewhere, they are unpredictable, as we heard today. There was a great story shared.
Yeah.
That, you know, to exercise more caution in certain situations is important. So
Another thing I noticed is the help that they give each other, the peer support with the weights or balancing or just sitting and having conversation. There was constant conversation amongst the whole group about different things that they'd been doing from the week before.
Right.
And I think that sometimes if people don't have a lot of family around to talk to or their neighbors, come to a class and talk to the people that are in the class. That is just as important.
Yes, absolutely. They come, there are a lot of friends that invite more friends because they know it's time to spend together.
Yeah.
So, because we're not so intensely working out that we can't visit. And we're usually in a semicircle, so there's plenty of eye contact and that ability to talk to one another. So it serves many purposes. So.
Yeah, absolutely. I loved it. I'm going to feel it tomorrow. But it's going to be good.
Yes.
It is going to be. All right, so we have talked about diabetes and we have talked about the importance of exercise. Yes. We have cooking classes.
Actually, there's one more exercise class that we haven't
Oh, I'm
touched
so
on.
sorry. I did forget it. I did. Go ahead.
That's okay. So on Wednesdays at noon, we do have a Walk with Ease class.
Yes.
So Walk with Ease is more, we do a lot of stretching. So just getting people, again, if people have not been out walking or more sedentary, it's taking time to stretch, do a little light weight training, and then we do just a short walk. We kind of, all of these classes can be geared to the level that people are. So even in sail, if they're not up to it, they can do fewer repetitions. They can gear it to them. And this walking also, right now the walk is up to about 15 minutes, and then we come back to our lift in the office, and then we repeat those stretching exercises, and we start to hold them a little bit longer. So as someone mentioned in class today, this has really helped her mobility. So a lot of times we don't realize what we're not using.
Yes.
And when we get into these classes, we think, oh, yes, I can, this is really helping move all parts of my body, which is so important. So
yes. And it's not intimidating at all. If you don't want to use the light weights, you don't have to.
Exactly.
There was a couple members today that they couldn't use the arm weights. So nothing was said. They still participated. They just didn't use the weights.
Right.
And it's great. All right. Walking tomorrow then, huh?
Yes, at noon. It's a 1 hour. When we get all those stretches in, we take the walk, come back and stretch some more. Again, there's a little time to visit. So it does take about an hour. So right now we're doing it outside because the weather's nice. This winter we will be in the mall doing the same class.
At the mall? Nice.
Just because people, again, when the weather gets cold, it's nice to have options for exercise. So yeah.
Nice. All right. So now all the exercise classes.
And I think we got it.
You got it. So let's talk about healthy cooking. We offer a simple healthy cooking class.
Right.
What can you tell me about that? Because I'm looking forward to that too.
Right. So a lot of times when we hear during our classes, people are busy. Retired people are the first ones to say, oh, I thought I'd have all this time. And they actually are a lot busier, or even young families, anybody who is having a hard time thinking of healthy things and alternative to just stopping at a drive-through. We want to offer kind of simple, healthy meal prep ideas and meal ideas. So this Thursday, we are partnering with MSU's County Extension Agent, Erin Gregory, and she is coming with us, and her skills are more in the safety aspect, being able to use good knife skills, and she's going to bring her recipe, and she'll walk us through that process. And then the fun thing is, once we do that, we can discuss what are alternatives. Like, this is one recipe. What other things can we do to vary this and make these just easy go-to recipes that anybody can throw together?
Yeah.
So
it is all about simplicity anymore. The big meals at 5 o'clock at night, I don't think people do those anymore.
Right.
Because dual working families, sometimes elderly people or people that spend more time at home, they just don't want a big meal. I know I don't. I don't have children at home anymore, so the things that are just sheet pan meals. Whoever thought of sheet pan meals? Yes.
Yes. And you even had an idea, since it's fall, of kind of a simple soup recipe.
Oh yes, it is fall, soup season, my favorite. Get a bag of frozen vegetables, peas, corn, and carrots, and you can put some protein with it. So ground turkey, ground chicken, ground burger, get some beef broth, low sodium, and fry up the meat, put everything in a pan with the broth, warm it all up, and you've got just a warm soup. And I do love a good soup. Yeah.
Right.
Yeah.
It's always better the next day, so it's fun to have.
It is. I say all the seasonings get all married together with the vegetables, and soup always tastes better the next day.
Yep.
Potato soup is the same way too. A lot of grocery stores have pre-cut vegetables. So if you want like a squash soup, you can get pre-cut and put everything in a pot and just make your soup.
Right.
Yeah.
Yes. Yes. So that's essentially this class is, we'll make a meal, but then we can share ideas. Hey, what are some other easy meals? Or what have you tried that you really like? And share those ideas and keep it on the healthier side.
Different meat options. Some people don't like a lot of beef. You can use chicken, you can use lamb, turkey. Yeah.
Yep.
Absolutely. Okay. Good. Looking forward to that one too. So also at LIFTT, we offer health and wellness workshops.
Right.
On September 29th at 3:30, we're showing a documentary. What are we doing?
Sure. So on Mondays, I teach a brain health class.
Yep.
And kind of spilling into that class, we're going to watch the documentary Memories for Life. It highlights Dr. Bredesen, who has a protocol that has been proven to help people prevent and even reverse cognitive decline. So it's very interesting, his story and the kind of the struggles that he's had to get that out there, because there's many things that affect our brain health. So when he wanted to do trials, he's been denied because there's not one single thing that you need to do to help your brain health. So it's fun. It's very motivating for the people that take the brain health classes at LIFTT to see, hey, there are people out there that before this was getting more known that have actually done this, and they were declining and they have been able to bring it back. Interestingly, if you tune into TV much or online, there's a lady called Judy. She was Dr. Bredesen's first patient. He had just been denied a clinical trial. She came to him and said, I'm losing my memory. I cannot wait for this trial to happen. So he laid it out for her and said, if you were in my trial, this was what I would have you do. She was 67 at the time. She's 81 right now. She is walking from California all the way to Florida with the message.
That is just
Yeah. So that
heartwarming.
her message is this is possible. So
I did see you teach your class.
that's
I
good.
attended online, and the questions that they were asking and the information that you were giving on that class, people need to know. People need to know that there are resources, and we have them for all of these classes. We are willing to answer all the questions. People can call at any time and talk to any of us about it.
Right.
And the classes charges?
Oh, good question. Which always comes up. The nice thing is we do get grants for these. So I always say in exchange for any money, we don't take money, but we do have you fill out some intake papers. So it's usually just demographic information. And then there's some waivers. We're HIPAA compliant, so we're not going to share your information.
No.
We're going to keep it confidential. So that helps us keep grant money coming in, so we do not have to charge for these classes, which is very nice. Again, we have a lot of retired people or people on a fixed income, and it makes it accessible to anyone.
People on fixed income, they can't afford a gym. So they can come down, they can sit in a group of lovely people. Oh, those people today were just so much fun. I just loved it. The conversations, listening to them. And it is free, and they had so much fun.
Right.
They did. And my lower back is going to tell me about it tomorrow. Anything, so you teach brain health classes.
Yes.
Is there anything else that we need to talk about?
Right. The big thing is, if you're interested in learning more, you're welcome to give us a call. Our number is on the screen. And just reach out. We have a variety of classes. Maybe you've heard about something and don't kind of have an idea and say, hey, just go ahead and call us and we can sure walk through it with you. We have diabetes prevention, exercise classes. There's a brain health class if you're worried about developing dementia. Even for younger people who, maybe just feel that there's something off, there's a younger version of the brain health class. So just, our number is on the screen. We'd be happy to visit with you, and really anyone qualifies for our services. So.
Excellent.
All right. Well, we look forward to hearing from you. Again, reach out with any questions, and thank you for tuning in.